Okay, so Bachit, this gets us to a second part of chronic inflammation. That is, chronic inflammation is followed by wound healing. So starting with wound healing, देखो, this is just 10% of the chapter inflammation, but in every paper you get one or two questions from this. A very very important topic. First point, wound healing. Wound healing. Cells on the basis of regenerative ability. Cells on the basis of regenerative ability, कि cells कितना regenerate होते हैं. On the basis of regenerative ability, I can divide cells into three types. तीन type के cells हैं. That is labile cells. They can either be labile cells, stable cells. They are labile, stable cells, or permanent cells. On the basis of regenerative ability, cells तीन type के हैं. That is labile, stable और permanent. Labile cells, these are continuously dividing in nature. ये continuously divide करते हैं. They are continuously dividing. Stable cells, they divide under stress. Stable cells, they divide under stress or injurious stimulus only. They divide under stress or injurious stimulus. Versus permanent cells which are non-dividing in nature. First point, let us start with stable cells. Stable cells, they divide under stress or injurious stimulus. So they are present in which phase of the cell cycle? They are present in G0. They are seen in G0 or quiescent phase. They are present in G0 or quiescent phase of the cell cycle. G0 or the quiescent phase. Next point, they have limited division या unlimited division. मतलब limited division है कि divide करते ही रहते हैं. They have a limited division potential. They have a limited division potential. Next point, which muscle is stable cell? तीन टाइप की मसल्स है, स्केलेटल मसल, स्मूथ मसल एंड कार्डियक. स्टेबल कौन सी है? स्मूथ मसल. वेरी वेरी इंपॉर्टेंट. एग्जाम्पल्स ऑफ स्टेबल सेल्स, दैट इज स्मूथ मसल is a stable cell versus cardiac and skeletal muscle which are permanent cells versus cardiac muscle, skeletal muscle, skeletal muscle and neurons. Cardiac muscle, skeletal muscle and neurons which are permanent cells. Next point, main question जो इस पे आता है, that is the examples of stable cells. Stable cells कौन कौन से हैं? That is smooth muscle. Next example is cells of kidney, liver and pancreas. Cells of kidney, liver and pancreas. Next is vascular endothelial cells. Next example is vascular endothelial cells. That is why remember हम लोगों ने cell injury में भी देखा था, I can do a live organ transplant in cases of liver. I can donate a part of my liver to my relative in case he is suffering from chronic liver disease because hepatocytes regenerate. They divide under stress or injurious stimulus. It is a stable cell. Next point, stable cell की limited division थी कि unlimited? They had limited replicative potential except liver which has unlimited replication. Next point, this gets us to our first category, that is labile cells. Labile are the continuously dividing cells. Which are the examples of labile cells? Examples, stratified. Firstly, let us start with bone marrow. Bone marrow में cells, they continuously regenerate. So that is, the first example is hematopoietic cells. Hematopoietic cells of bone marrow. Next is all the epithelium, that is stratified squamous epithelium. कहाँ present है? Which is present in skin, oral cavity, esophagus, cervix and vagina. Stratified squamous epithelium. Stratified squamous epithelium, which is present in skin, oral cavity, esophagus, cervix and vagina. Stratified squamous epithelium. Next example of labile cell is columnar epithelium. Next example is columnar epithelium. Columnar epithelium of the GIT. Columnar epithelium of GIT. Next is sare epithelium. Next example is transitional epithelium. All the epithelium, they continuously regenerate. Transitional epithelium. Where is transitional epithelium present? Transitional epithelium of genitourinary tract. Transitional epithelium of genitourinary tract. Transitional epithelium of genitourinary tract. And lastly is cuboidal epithelium. Lastly is cuboidal epithelium of the ducts. Cuboidal epithelium of the ducts of lacrimal and salivary glands. Lacrimal and salivary glands and biliary tract. Lacrimal and the salivary glands and biliary tract and the biliary epithelium. All these are labile cells. जब भी इस पर क्वेश्चन आता है, there is usually no confusion in labile cells. सारे epithelium, columnar, cuboidal, stratified squamous, transitional, all the epithelium are labile. They continuously divide. Hematopoietic cells of bone marrow is a labile cell. Main confusion is with respect to stable cells. Very, very important. Stable cells. Stable cells कौन से हैं? That is smooth muscle. Cardiac muscle and skeletal muscle is permanent. Smooth muscle बच्चे is a stable cell. Other examples of stable cells are cells of kidney, liver, pancreas, vascular endothelial cells. Permanent cells कौन से थे? Cardiac muscle, skeletal muscle and neurons. अच्छा मुझे एक चीज़ और बताओ. We have already done this though. Permanent cells, they undergo hypertrophy या hyperplasia. Permanent cells में क्या होता है? They undergo hypertrophy. They undergo an increase in size of the cell. Not the increase in number because they are non-dividing. They undergo hypertrophy. Next point. So, in tissue repair, we divided the cells on the basis of regenerative ability into labile, stable and permanent cells. First point. Next point. This gets us to wound healing. Wound healing occurs by two mechanisms. It can either be wound healing by primary intention. Wound healing occurs by two mechanisms. It can either be wound healing by primary intention or wound healing by secondary intention. या तो प्राइमरी इंटेंशन से हो सकती है या सेकेंडरी इंटेंशन से. इन वुंड हीलिंग बाय प्राइमरी इंटेंशन, in primary intention, it is a clear surgical wound. It is a clear surgical wound. In healing by primary intention, there is no space or no large gap between the wound. It is a clear surgical wound. Versus healing by secondary intention, which is a large gaping wound. Versus in secondary intention, which is a large gaping wound. There is a lot of space in between the wound. It is a large gaping wound. So I can safely say tissue damage. Tissue damage, granulation tissue formation, tissue damage, granulation tissue formation and scarring. Tissue damage, granulation tissue formation and scarring is less in healing by primary intention versus more in healing by secondary intention. Secondary intention में it was a large gaping wound. Wound में बहुत सारा space था ना बच्चे. It was a large gaping wound. So tissue damage भी ज़्यादा है. अगर एक बड़ा सा gaping wound है, tissue damage भी ज़्यादा है. There is more tissue damage, granulation tissue formation as well as scarring in healing by secondary intention versus they are less in primary intention. Very obvious. Next point. This gets us to time periods of wound healing. This gets us to time periods time periods of wound healing. Time periods of wound healing. Again, sort of commonsensical. देखो, remember the last time you were physically hurt? No double meanings. हम खेल रहे थे, चोट लग गई. So when we get physically hurt, सबसे पहले on day zero, there is scab formation. On day zero, there is scab formation. Scab formation मतलब एक वो पतली सी पपड़ी बनती है ना, that is called as a scab. Day zero is scab formation, which is just fibrin and platelet clot. सबसे पहले तो scab बना, which is fibrin and platelet clot. Next point, day one, which is the first cell of acute inflammation. सबसे पहले कौन सा सेल आया? Which is the cell of acute inflammation? Neutrophil. So it is associated with